Zimbabwe's water and sanitation coverage significantly declined in the last decade as a result of inadequate financial resources, socio-economic challenges, weakened institutions, and deteriorating standards of essential services offered by local government. Once leading in both water and sanitation coverage in Southern Africa, Zimbabwe saw a drastic decrease in the gains of the 1980s. In light of these dramatic economic developments, the prevalence of HIV/AIDS, poverty, poor waste management, and lack of safe drinking water, compounded by the economic decline, reducing national government capacity for investing in key sectors such as health, water, and sanitation, health conditions deteriorated, leading to the cholera epidemic of 2007-2009. The European Union, through the ACP EU Water Facility, in partnership with UNICEF, funded the ZimWASH project in order to address the water and sanitation needs of the poor in the context of HIV and AIDS in Zimbabwe, guaranteeing access to water and sanitation facilities to at least 6 districts of Zimbabwe. This is the journey we have taken.
The ZimWASH project is looking at the orphans and vulnerable children. We are looking, when we say orphans and vulnerable children, we are looking at those, a child under the age of 18 who has lost one or both parents, and also other vulnerable children, like those whose parents are terminally ill. We also look at those infected by HIV and AIDS. The ZimWASH project is targeting those with the provision of water, sanitation, and hygiene facilities.
As a national program, we have benefited from this ZimWASH project in the sense that there has been a lot of training of our local communities, empowerment of communities in hygiene promotion, also empowerment of our local artisans, such as village pump mechanics, latrine builders.
The ZimWASH project, working through its partners, have been implementing projects in 6 districts of the country, namely Chipinge, Chegutu, Hwange, Bulilima, and Mangwe in the semi-arid regions of Zimbabwe.
The ZimWASH project is trying to help the vulnerable people in Zimbabwe, and we have chosen 5 districts which were chosen because of a nutritional study survey that showed that these were the districts most vulnerable. But then, of course, in Zimbabwe, everyone is vulnerable. If you ask me, it depends on the scale of vulnerability. Right. Given what we have gone through, you'll find that virtually most people are vulnerable, which brings me to a point. Why am I saying most people are vulnerable? Even the RDCs, the Rural District Councils that are supposed to be implementing ZimWASH, are vulnerable. They don't have the capacity. So as IWSD, we are strengthening, we are bringing in the capacity development, which means the institutional strengthening as a local authority and the human resource development. And we are mainly focusing on the various aspects: capacity to be able to identify research gaps, train, develop tools, collect data, and be able to write a report. So that's one niche area. And capacity to be able to conduct strategic planning and roll out those plans with the business plans that go with the strategic planning. So we have been involved throughout, and we have also developed other areas like livelihoods, how to use livelihoods, and we've been doing training linking livelihoods and water, and we've been carrying out that training within the districts. So as IWSD, we can say we focus more on the software components of the project.
In 2008, we experienced an outbreak of cholera, and this was a national problem, but Chipinge was one of those hard-hit districts. The project went a long way to alleviate the suffering that we are actually being, the suffering that was in the community by quickly responding to the cholera.
Generally, our Mangwe falls, mostly of it falls in region 4 and 5, which is dry, it is erratic rain, and we have problems of water. Between June and November, our water level drops and sources of water become very few and far apart. And also when we look at hygiene factors, because ZimWASH also, it does not only look at the issue of capacitating the software, it has also some hardware component whereby the provision of toilets or latrines. But before you can do that, you can construct them, but if you don't address the issues of software, people will still actually go to the bush. So you have to go to a lot of training of PHHE issues, particularly health and hygiene issues.
Livelihood projects aim to enhance the food security of the vulnerable communities through opportunities for improved food production. These 6 districts, with the exception of Chegutu, are generally the most dry and marginal areas, falling under the agroecological regions 4 and 5 and receiving less than normal rainfall. These livelihood activities are an essential part of the ZimWASH project in order to bring food security and hope to the orphans and vulnerable people in these marginalized communities. The ZimWASH project is building capacities of vulnerable communities through increased productivity, innovation, and hence well-being. The project also increased access to a range of irrigation technologies, including drip kits and rainwater harvesting tanks. One group that benefited is the Ndazi Trust of Bulilima, which has more than 200 vulnerable children in their support.
The main objective of forming this trust was to protect and take care of vulnerable kids. As we started this trust, we ended up getting some help from Brahmins who gave us some drip kits. We are using it for watering so that when we get the proceeds from the vegetables, we can as well assist the vulnerable kids. In addition to the project, we have got the abattoir and piggery.
There are integrated nutritional gardens lush with fresh green vegetables such as rape, onions and tomatoes. These initiatives have significantly improved and contributed to better nutrition and improved livelihoods. In spite of all these important community benefits, schools in these rural communities lack drinking water, sanitation and hygiene facilities, which is an unfortunate scenario. Girls and boys are affected in different ways by inadequate water supply, sanitation and hygiene conditions in schools. Now, efforts have been made to repair broken boreholes, construct water harvesting reservoirs, and build new latrines, creating an appropriate learning environment for both boys and girls. Capacity building at community level was a major focus in this project because it ensured sustainable management of services. Various initiatives, such as participation of communities at all planning meetings, community-based management training, participatory health and hygiene education, and other community empowering tools. There was also on-site building construction training to ensure that hundreds of beneficiaries attained basic building skills, and women builders were also trained by the project. Village pump mechanics were also trained in repair and maintenance of various types of boreholes.
I am one of the village pump minders trained by ZimWASH. We trained firstly the theoretical part of it, then we go to practical part of it. Now I am able to maintain a borehole.
Despite the training and commitment to implementing these activities, the VPMs are experiencing challenges in acquiring the right tools for the job.
Tinotenda ZimWASH yakatibatsira nebhoro. Taiva vanhu vaitambudzika mvura taifamba distance about 10 kilometers. Asiko zvinotarerukirwa utano hwedu hwava hwakaendeka.
This is clearly a case of successful community-based management of a wash service. The area around the boreholes is maintained and the community erected a fence around it, making sure that animals do not destroy or pollute the water source. One very effective training method is role-playing. This is an excellent technique to reach and bring health and hygiene messages to communities. Using visioning techniques, villagers identify critical areas of focus and learn positive behavior. This drama involves extended role play, highlighting issues of hygiene, especially after the devastating effects of the cholera epidemic that hit almost the entire country. To date, great strides have been made, and various hardware installations have been established in all the major districts through implementing partners in the ZimWASH project. By this approach, many vulnerable groups participated and are now happy owners of beautiful latrines.
Mvuramanzi Trust is the implementing partner who does most of the groundwork at local beneficiary level. So far, our target for household latrines is 6,750 in the 5 years, and we are just slightly above 4,000 latrines so far, with a year to go.
We, from the ZimWASH project, we have learned quite a number of lessons, which as a program will assist in feeding into the policies. The issue of extensive hygiene promotion, the issue of coming up with committees at community level, and also the issue of empowering the structures is quite a good lesson that we have captured as a national program, and those will definitely feed into our policies, into our strategies, and also in our guidelines when we plan for the future.
One key lesson that we have got from the ZimWASH project is on sustainability. For a project to be sustainable, there is a need for capacity at community level. And the ZimWASH project has really tried. Initially, we tried with building capacity at district level. But at district level, you'll find that there's a lot of staff turnover. Attrition rate is very high. But when you go down to the community level, the community, the members of the community there are more stable than at district level. And it is very prudent for any project to really focus its capacity development initiatives at community level if we have to build any sustainability in these projects.
We would like to very much to thank the donors that actually made it possible by giving us some funds. I want to thank UNICEF and the EU, European Union, for giving us funds to alleviate some of these problems or the challenges that we are facing in the district through natural disasters.
We are very happy and very much appreciative of this support. It's a rare support, especially during these difficult times. And also what we can say also is that the support that we got has gone a long way, especially in sustaining what we have put in place, because it's a rare project that is focusing on community empowerment first before you can provide.
Through partnership, this is the only way we can tackle the scale and urgency of the challenges facing Zimbabwe today.